ask people for story ideas. We had a story idea recently from a lovely lady called Susie Jarrett, who happens to be a journalist, an equine journalist of all things, and she put us on to a bloke called Rob Willis. Now,
Dr. Rob Willis.
Oh, sorry. Excuse me. G'day, Rob.
Good morning. How are you going?
Now, you're a vet of all kinds of things, but mostly horses, an equine vet. Tell us what an equine vet does.
So, health and prevention, treatments, injuries, sickness, just the whole box and dice, I guess. So, but generally with horses, I do a little bit of both. I do dogs and cats as well. But yeah, certainly the bulk is horse work.
But you have more than one set of tools in your toolbox, as the saying goes, in terms of how you treat them. You're a great believer in acupuncture. How did you get started with the idea that acupuncture and Chinese herbs would actually make a difference?
Yeah, it's probably a funny story, and a lot of people ask me this because it's not the commonly done thing, especially with a veterinary background. But my old boss, she's quite forward-thinking. Jana Stevenson, she runs a practice up in Albury. And she actually asked me if I'd learn acupuncture so we could offer it to our clients at the practice. And so anyway, she already did chemotherapy and advanced surgeries and things, so I thought I'd sort of pull my weight and go and learn acupuncture. I was not really a proponent of it, but I wasn't kind of against it either way. And so I went and did the course. More for, doing my bit to the practice, and the more I did of it, the more I liked it, I guess, and off it went.
Was that because of the results, or
yeah, it was.
Exciting?
Yeah, definitely. It was because of the results. I was actually surprised by the results I was getting, and, I'd done veterinary practice for about 6 or 7 years before I did this. And, the results of what I was doing were kind of not really adding up in my head for what I expected should be outcomes of doing something like this. So that's definitely, that's what got me hooked.
Have you got a couple of specific examples you can tell us about? Because we're not vets and we don't know a lot about horses other than we like them.
Yeah, sure. Especially that practice I worked at was a small animal practice. So most of my early stuff was on dogs at the practice. It was more in and around Albury where the practice was that when they heard there was a vet doing acupuncture, that I started getting calls to do horses, and that's how that got going. I was doing horses after hours and weekends, and that kind of then took over. So much to the disgust of my boss, because I actually ended up leaving the practice to do it full time. So but we still keep in touch now and get along really good.
So what ailments really respond well to acupuncture for horses?
Look, most of the demand is musculoskeletal, and same with dogs. So generally sore backs, sore pelvises.
I was first called out to see Reggie for a sore back. The owner had noticed that his back was sore. I'd found he had a right pelvic problem that the back pain was coming from, and we treated that, but he didn't really respond very well. That was because the pain from his feet at the time with his chronic laminitis was causing a referred pain up through that back end. Testing we've done since has revealed some arthritis in his stifle and his hock, so we're actually going to use a course of Penazan today as well to help treat him with his arthritis. And that's kind of the idea of treating things holistically. You use as much as you can from different angles to try and get the best overall result. So we've actually done a few things with Reggie. We're doing acupuncture to correct basically the underlying energy problems in his body to try and prevent this from coming on again. He's going to have a course of Penazan to help him with his arthritis. And we've also done some diagnostics, Angela Davison, some testing up there as well, hair testing to help identify some of his underlying nutritional problems and deficiencies.
If we're getting results with things like arthritis, I really do believe it's from getting soft tissue and fascial release around these structures.
Can you explain that in layman's terms?
Layman's terms, yeah, sure. I think you're putting the needles into specific points on the body to try and bring about a response in the horse. So that might be just pain relief for sore muscles. It might be respiratory things also work quite well. So, horses that have, say, coughs and colds and flus and things like that. When I say like fascial release. We use it a lot for sore, stiff animals, and it's commonly known that acupuncture works really well for arthritis. My personal thoughts are, though, that where the pain relief is coming from is from the tight muscle and the wrappings around the joints that you're getting to let go, rather than in the actual bone itself. So, yeah.
We were talking earlier off camera about me having acupuncture on my knees for arthritis.
Wonderful.
Sure.
Old fella that I am.
Yeah, sure.
It doesn't last forever, but
No.
Some people said, "Oh yeah, but you just wanted it to work," and that's the placebo effect. But then explained about our dog Monet. He had a acupuncture needle. He's had several actually, and he was just like chilled out. So there's no placebo effect with animals, is it? How does it work? How does acupuncture actually, stop that pain?
It kind of depends.
30 seconds or less.
30 seconds or less. It kind of depends on whether you want the Chinese version or the Western version. I'll give you the Western version. There's a big endorphin release in the body when you stimulate these points. So they're kind of your feel-good chemicals in your body and your brain. And they have a pain relief effect, they think, between 10 and 100 times the power of morphine if you hit the right spot. So that's where they get that sudden sort of yawning and tiredness that comes over them too. It's like they've just had a big morphine hit, I guess, in a way.
I've seen that firsthand, and I know that you've seen it firsthand in horses as well. Is it possible to do acupressure on horses, being such a large animal? I know we can do it on dogs and cats.
Sure. I mean, acupressure is just manual pressure onto an acupuncture point. I do a little bit of it, not too much, but a lot of the soft tissue therapists that do equine massage and things like that, they incorporate a lot of acupressure in their treatments. So,
okay. Yeah. Also, I want to ask you quickly, Brian's trying to get a word in, but he can't.
Yeah.
Facebook page says acupuncture and energetics. Is that to do with the nutraceuticals and things that you are really fond of?
Yeah, it is. Look, the energetics, most of your alternative therapies work off Eastern principles, and most of them rely on flow of energy and things like that in the body. Energetics kind of incorporates a lot of things beyond that. It has to do, I do osteopathic type release and manipulation, and it's kind of like incorporates all the Eastern aspects plus all the kind of Western aspects of biomechanics and things like that. It was a bit of a fancy word I came up with at the time and thought it was not too bad. So
got mine.
It's pretty. A lot of your contemporaries, I know, probably use the word ooga booga when referring to Chinese herbal medicine, etc. I mean, I've been involved in a little bit of it, recording some stuff for College of Integrated Veterinary Therapies, CIVT, with Barbara Fougere, and I do know the upper burner, the middle burner, and the lower burner.
Yeah.
But that's as far as I know, and that seems to be as far as a lot of conventional vets know and understand. What is it that you'd like them to understand about traditional Chinese medicine and acupuncture?
Yeah, sure. I could probably talk for hours on this, but the basics are that you don't have to understand the ooga booga for it to be effective. It's kind of just that, like my colleagues and things, I get a lot that ask about it. They're genuinely interested. If you start talking about energy to vets, you lose them straight away. It's like, Rob's lost his marbles. But then if you kind of, bring that back to Western terms, we had a great scientist called Albert Einstein that talked about energy for about 30 or 40 years, So you put it in that terms, and then they start to make the links. In terms of outcomes, though, for animals, it's just nice to have vets that do refer when they're kind of at their limits of what they can do, because there's a lot of good you can do whether you're into the ooga booga or not. So
you got a word.
Let's use that working with the late Peter Brock, who used to talk about energy a lot, and people in the motor industry used to have glazed eyes when he talked about energy as well. But we learned.
Yeah, sure.
Yeah.
All righty.
Yeah.
Sorry?
I think energy. As soon as you mention energy, I think the kind of real left brain, scientific mind switch straight off.
Yep.
So I don't talk too much about energy, but you can challenge, especially the vet students that come through, because they're probably the big, ones that go, I don't know about this, and they're kind of the people that you can tap into and say, well, what about, Albert Einstein with his E equals MC squared? What's that formula about? And that really switches some light globes on when you do that. It really messes with them.
Yeah, fresh brains that you can mould.
Yeah, that's it. Generally, yeah, vets are really good. I find them pretty open in general, but you just got to talk the right language. So
That's good.
Yeah.
Well, Rob Willis, we wish you all the best. We hope we actually can talk with you again about horses. One last thing, how big is a needle for a horse compared to, say, a dog or a cat? Are they like extra large needles?
It's funny, a lot of them are actually the same size. We use a lot of what are called ting points, where we do around the coronet bands in a horse, just above the hoof. And so you only really need little needles for those spots, otherwise you're into some pretty important sort of structures there. So yeah, you'd think you'd go for a really big needle, but generally they're similar sizes, so yeah.
Amazing. Well, I can't wait to see some of your videos, and we'll add them to this interview, and we'll certainly let everyone know where they can track you down.
Sure, no worries, sounds great. Thanks, guys.
Okay, thanks, Rob.
Thank you.